we heard so much about mental health in the lead up to COVID and, a lot of generalities. What's actually happening out there as a result? What's different right now and worse about mental health in Australia?
Yes, well, thank you. Basically, and particularly here in Victoria, we are seeing a major surge of need for care. Basically, about a 20% increase or more of people seeking help from a system that really is closed. It's very, very difficult to get into. The only way in typically is in through emergency departments because the rest of the system has got access block. And in emergency departments in the last few weeks, we've seen a 33% rise in Victoria of self-harm amongst young people. So the surge that we predicted some months ago is actually now hit. I'm not sure about the data from the rest of the country. Obviously, Victoria is under severe stage 4 lockdown, so the community here are really feeling it, and it's starting to push people over the edge, which is what we predicted some months ago. Now, the positive news here is that both the federal and the state government have responded in recent days with a new package, and Prime Minister basically got involved directly himself and was briefed that what we need to do is outreach teams, basically put boots on the ground so that we actually get to people in the community, in their homes, with mental health expertise before they ending up needing to be in emergency departments and having self-harm. The suicide risk is very significant. In our own service here in Western Melbourne, we've heard of 2 suicides of our patients in the last 2 days, which is serious tragedy and preventable death. But we really need to actually strengthen our mental health system urgently, and we've got to be creative. We've got to find new workforces. We've got to deploy them and support them because the current workforce is wilting under the pressure.
So you mentioned there young people in Victoria. We've got this entire cohort of, Year 12 students, but let's be honest as well, plenty of other year levels wondering what's happening, remote learning, none of the usual rites of passage they're getting as well, and the jobs market that's being spoken about. When you say the only way they can access mental health normally in this lockdown is through emergency, so what are the other aspects? You were talking about getting out there and boots on the ground, that without those extra services, the only way they get these services is emergency. What are the other ways they can do it?
Primary care, GPs. GPs are more difficult to access at present. Telehealth's definitely played a useful role, and the government deserves credit for setting that up, but the system is less accessible than it was before. And we know already before the pandemic that the mental health system was in crisis. It was overwhelmed in the first place. So that's the problem we're trying to deal with here. So it's very important that people do seek help because there is help available, but it takes a bit of an effort to find it. And the government is ramping things up. But the rate limiting things now are workforce and I suppose the capacity of a fairly exhausted workforce to actually respond. We need very strong and decisive leadership here to meet this aspect of the crisis, which is actually potentially killing more people now than COVID.
Well, every prospect of that. So what about workforce? Just finally, is there a possibility, as in other workforces, more people might be sent to Victoria, or is it other states and territories, there's no slack in their system either?
Task force been set up with the Deputy Chief Medical Officer, Ruth Vine, and state officials here in Victoria to look at this and to put on the ground the 15 new pop-up adult centres that the Prime Minister launched or announced the other day. So that is the sort of thing that we have been asking for, and the Prime Minister and Greg Hunt have come to the party here with funding for this. So we really have to make sure this gets put on the ground and we actually redeploy and divert workers to this sort of model of care so we don't see people ending up in desperate situations in emergency departments. We've got to get ahead of the curve here.
We've just got 30 seconds, but what about the government plan to increase the cost of degrees for social workers? I mean, I know that's a while away from impacting, but is that a concern?
Well, look, we need new workforces, not just social workers. We need a whole range of new workforces, occupational therapists, psychologists, psychiatrists, and peer workers. We need a range of creative solutions, and we need people that are properly supported to do the job. So they're not dealing with, as our team are in the Western Suburbs, 130 acutely unwell young people to manage on a single day.